Yeah, there are a few trials that I think I will go home and share with my colleagues, and at least one would likely influence my practice. The HERIZON-GEA-01 trial is a trial that I think it's practice changing. It is a phase 3 trial where patients with advanced gastroesophageal junction that express HER2 were really treated with a HER2 targeting therapy with Zanidatamab in combination with chemotherapy in one arm. In another arm, the Zanidatamab was given in combination with chemotherapy and immune checkpoint inhibitor, Tislelizumab. This was compared to the previous standard of care, which was chemotherapy plus trastuzumab. In this trial, we have seen that the progression-free survival improved by around 4 months in the regimen that contained Zanidatamab. And then the overall survival was statistically significant and longer in patients who were treated with chemo plus Zanidatamab plus immune checkpoint inhibitor. One thing to highlight here is that the benefit was observed across all pre-specified subgroups, including patients with a negative PD-L1. How this would change my practice? This is now a new regimen that I can use in my patient. Obviously, the previous standard of care has changed. Now we don't use just chemo plus trastuzumab. We use chemo plus trastuzumab plus immune checkpoint inhibitor like pembrolizumab. So this is another regimen, but also for patients who do not qualify for an immune checkpoint inhibitor, either previously because PD-L1 was negative or because they have contraindication to PD-L1. At least now the chemotherapy plus Zanidatamab is an option that you can use instead of the previous chemotherapy plus trastuzumab. That's one trial. One other trial to highlight was the ILUSTRO trial. This is really a nice trial where it showed that patients who also advanced gastroesophageal adenocarcinoma that express PD-L1 and Claudin 18.2, instead of just sequencing treatment, now you can actually treat them with chemotherapy plus immune checkpoint inhibitor plus a Claudin 18.2 inhibitor, zolbetuximab. This is the trial that was discussed was, the ILUSTRO was a phase 2 trial. It showed promising efficacy. There is a plan to launch a phase 3 trial. Obviously, I think it's not maybe practice changing now, but likely in the future. In the colon cancer space, we anticipate 2 trials we discussed today. One is the BREAKWATER trial, where the FOLFIRI plus Encorafenib and cetuximab data will be shared, which showed higher overall response rate. This is another good news for patients. We have previously had the FOLFOX plus EC approved by the FDA, and I hope now with the new data, we would anticipate potentially another FDA approval where patient also would benefit from FOLFIRI plus EC. Another trial that's supposed to be discussed today as well is the COMMIT trial. This is an interesting trial, but I don't think it's going to be practice changing, just because the way I would say it is this trial showed that combination of chemo plus anti-VEGF and PD-L1 appear to be better than immune checkpoint inhibitor as monotherapy, but the monotherapy really underperformed compared to what we've learned over the years when this trial was actually being accruing. So I think there's a ton of limitation, but what I know so far is limited information from the abstract. Once we have the final presentation, I guess I would have more information to digest and see how that would play out.